Hello, everybody. Thank you for joining us for the North Carolina Hmong Women Association Paving Pathways webinar made possible in collaboration with PABNEEG. So today will be hosted by Lisa, our team leader, and me, Brittany, one of the board members for NCHWA. We're going to introduce our speaker, and then we're going to dive into the interview questions and answers, and then we're going to close out afterwards. The purpose of our Paving Pathways webinar is to expose Hmong students and the community to different career opportunities and enrich them by providing valuable resources. We really want to identify and address gaps within the community regarding education, health, other social determinants, and again, really just to expose our Hmong students and community to different career opportunities that are out there and enriching our community by providing valuable information and resources.
Thank you to Brittany for providing an introduction to our webinar series. I just want to talk more about our collaboration with PABNEEG. We are collaborating with PABNEEG to promote their event that they will be hosting. It is a 2-day summit from June 8th through the 9th, and it is titled Hmong Women Lead Pioneering Mental Health Equity for Hmong Women. And this is going to be hosted at the University of Denver in Denver, Colorado. This is just really a unique opportunity for Hmong women to get together and have open, honest conversations about mental health, mental well-being. Throughout the time here, they will also have different workshops where you can learn how to overcome and combat some mental health challenges that you may have faced. Here on the slide, we do have the link available for you to register for the event. I will transition into introducing our speaker for today. I'm so happy to introduce Lina. Lina is currently an outpatient therapist at a private practice located in Hickory. She graduated from UNC Greensboro in 2015 with a bachelor's in sociology. She worked in the nonprofit field for a few years and then decided to continue her education. In 2020, she earned her master's in social work from UNCG and North Carolina A&T University's joint program. Currently, she holds 2 licenses. She's licensed in school social work, and she is also a licensed clinical social worker associate. She has experience working with students in the school and after school setting, and also individuals experiencing homelessness, ACT community mental health, and outpatient mental health as well. She also shares her 5-year goal, which is to open her own private practice and focus on developing and specializing in culturally competent treatments for Asian American. And I will pause for a second and just let Lina say hi, introduce herself.
Hi, everyone. My name is Lina. Thank you, Brittany and Lisa, for this opportunity to just participate and share what I know and share my experiences as well.
We're so happy to have you, Lina.
Thank
And
you.
with that, I will just transition next into our interview questions and answers. Like our previous webinars, we separate our questions into different categories: background questions, education experience question, Hmong identity questions, and then our closing questions. So our first question here for you, Lina, is to please explain your current job title and associated roles and tasks.
Right now, I work as an outpatient therapist. My kind of roles and responsibilities include assessing, diagnosing, and treating mental and emotional disorders. I serve kids ages 6 to 11, and then I also work with adults that's 18 years and up. As far as like being an LCSWA, like I also have responsibilities to continue my education. So that means like participating and investing in trainings, tracking my hours, and keeping regular consultation with my clinical supervisor.
Thank you for sharing a little bit more about what you do. Our next question here is, can you compare and contrast your experiences working in a school setting to a private practice setting?
Yeah, so as far as my experience has been, working in the school setting is not clinically focused. It's more of like a support role. So you do like attendance tracking or just offer a lot of like resource and support to teachers or students and families. You're not assessing or diagnosing or treating, none of the more clinical aspect of what I do now. So in private practice or outpatient therapy, what I'm doing now is more clinical. So the assessment, the treatment, and more of what I was looking for when I went into this profession for sure. But definitely going into school really helped me to understand what I wanted to do. So it was still a great experience, but it's definitely not really clinical work.
Thank you for sharing more about your experiences in both settings. It sounds like the decision for your transition was that you wanted to be a little bit more hands-on in the treatment and care.
Yeah, for sure. Although it really inspired me to go into social work, like a lot of the after school programs that I did do before going into my master's program, I felt like I could do more and I wanted to work with folks like individually. And doing like school social work, it's a lot of like collaborative work, which I don't mind, but I just didn't find that I really thrived in that environment. I just know like my strengths and it's just not where I was thriving.
Thank you for sharing like that answer and honesty. And it really shows that like it's okay to like take different directions and it's still good to like really have like that experience.
Our next question here is, what aspects of social work made you want to pursue this career path?
Yeah, and so before I applied for my graduate program, they had us write a personal statement. So I did a lot of like reflecting on my own experiences, and I'm like, what is kind of driving me to go into this field? And I found the answer in my own journey in education. Like as a first generation student, you know, kind of that assimilating into like Western culture and like just learning a different language, navigating like life in general, it was a challenge. And so I was just like, I think I would have really benefited from a school social worker reaching out, offering me support, or even like outside therapy, like having someone to talk to about this experience and learning like coping skills to navigate it so that didn't really transpire until adulthood, if that makes sense. And so just knowing my own experiences and wanting to kind of be that change for someone else and make that more accessible to other folks as well is really what drove me to pursue this career.
Definitely making resources more accessible is very important, especially like in today's like day and age.
The next question we have for you is, can you walk us through a day in your life as a licensed clinical social worker associate?
For the role I have now doing outpatient therapy, I would say it's pretty routine compared to my other roles that I've had in the past. I really just review my calendar for the day and see what time I'm scheduled to see my clients. I may like review past notes to see what we discussed in our last session and kind of bring those topics back up just to kind of see where they are in the progress with treatment. If I have an intake scheduled for that day, then I will also kind of review any like documents as far as like their referral or like their history, just to kind of get an idea of like what I'm going to be working with. I see my clients, I complete my assessments, um, document all that good stuff, and then I just go home.
Do you have like set schedules every day?
Great question. So I am a 1099 employee, and so essentially like I'm my own boss, and I make my own schedule. So with this group private practice, I kind of just have a set schedule for each day. Um, so like for Monday, for example, my hours are 9 to 4. So I schedule my clients within that time. And then for Tuesdays and Thursdays, those are my longer days that I allow for like those like after school sessions. So I may be seeing clients after like 5, 6, or even 7. So there's flexibility in it for sure. And then I make my own schedule as well. I have colleagues that don't work Fridays or they designate a whole like weekday for just their virtual clients. So there's a lot of flexibility with it.
I like how you have like the after school sessions, especially since you do treat some of the younger populations. That is a time that's available for them and their parents so that they can take that time to get the treatment or care that they need. Can you share a little bit more about what aspects of your work brings you the most joy and satisfaction?
Well, in school they teach us not to do it for like self-fulfillment, but I mean, if you don't love what you do, then it's kind of hard, right? When clients tell me that they leave feeling much better than they came, I always feel really good about that because I really pride myself on providing like a safe and non-judgmental space for my clients to come and, say what they need to say and learn ways to navigate life because it's hard. I also find a lot of satisfaction in seeing my clients put in the work and just seeing them grow like emotionally and intellectually in their own awareness and then putting in like steps to really improve um in their own life and in their relationships. That's always satisfying to see too.
I definitely agree that growth is such a satisfying thing to watch and, not just like with like people you work with, but also like yourself and seeing maybe sometimes seeing like yourself grow along with your patients is another thing that I've heard from like um social workers as well.
Yeah, and I struggle a lot with imposter syndrome, and so like just getting that validation that yes, I'm helpful, like I am doing good enough, and that feels good too, So it's kind of like it just reassures me that I'm on the right path and I'm doing what I want to do and what I'm meant to do.
Our next question is asking what educational path you took to become a social worker.
I was in school for quite a while. Honestly, I went in with kind of like my parents' expectations of what they wanted me to do. And then I got into a college and I kind of was like, this is the time for me to kind of discover myself. Like, what do I want? What do I like? And it took me a while, but I took some sociology classes and I loved it. I did really well. I loved learning about, human behavior and how like our upbringing has shaped us and our choices. And I just got really into it. And then I graduated from UNCG, like Lisa shared, with my undergrad in sociology. And I took some time off. I worked at an after school program for a few years, and I really just kind of took a mental break from school because I've been in school for so long. I was like, I need a break. But then the break was over, and I was like, okay, I got to go back to school. And I decided to pursue my master's in social work. And so I applied for it in 2018, got accepted. It was a 2-year program. I finished that during the peak of COVID, which was hard, but um, me and my cohort, we made it through and we all graduated. So yeah, that's kind of the path I took.
I can definitely relate to taking a little break from school just to allow yourself to reset.
Yeah.
I think during that time you do gain a lot of experiences as well. You share that you worked with a nonprofit realm, so I'm sure you gained a lot of knowledge during your time there and used it and applied it to your education.
Yeah, I definitely learned a lot of like practical skills. It was helpful.
Our next question is what qualifications or skills are essential for excelling in your profession?
To be a good social worker in general, it's important to have self-awareness, just knowing yourself, knowing kind of like your own limitations, knowing like your own kind of biases and like addressing them and just being open to learning. Like I consider myself like a lifelong learner. Like I don't know everything, and I'm not going to know everything. And so just really being motivated and staying motivated to continue learning because that's the only way I'm gonna, really grow in my profession is to continually learn and practice. I think I think for me, that's what's important, and a core value for me is just having that self-awareness.
The thing that really stuck out to me that you spoke about is checking your biases. Because for me personally, in my training as well, in the medical field, we were taught by our professors to check our biases at the door. So be aware of your implicit biases that you yourself may not even be aware of. Take the time to explore that and really learn what that is so that you don't project that onto your patients or clients, whether it's consciously or subconsciously.
Yeah.
I love that you shared that with us. The next question here is asking, what are the challenges you face in this career and how do you overcome them?
It kind of goes back to that self-awareness. So it just kind of navigating like my own personal beliefs and like my own feelings, because I'm human, I react to things, I respond to things. And so just keeping those things in check and seeking consultation, really utilizing like my peers for support, for advice, really reaching out to my clinical supervisor if I'm unsure of something, or if I feel like there is a barrier between me and my client, then really, addressing that and getting a second opinion. Like, I think that's really important. Really navigating like my own personal beliefs, because I know like being a mom myself and then working with kids, like sometimes I'm like, well, that's not how I would do something. But it's kind of like, well, it's not about how I would do something, it's meeting my clients like where they are, and not like you said, like projecting like my own thoughts and feelings into like my clients, because it's about their healing journey. And even though I think that this may work best for them, that doesn't mean it's true. Just coming to terms with that too can be challenging sometimes, because it's like it's a it's a belief that I have, right? And so challenging my own beliefs can be hard.
Thank you for sharing. Yeah, I agree. Definitely, like when I, for example, am planning like a program or a project at work, I always have to rely on my peers or my coworkers as well. Because maybe like the population that I am planning for is maybe I really don't understand them because I mean, I'm not them. So I definitely agree with, having those second opinions as well.
Our next question here is asking if you could give one piece of advice to those who are interested in this profession prior to pursuing the field, what would it be and why?
Try to get counseling or therapy for yourself. Kind of be on the receiving end of it, just to see the impact of it, to see if it's something that you feel you can do or that you would enjoy doing.
I guess I have a quick follow-up question, but is it easy for high school, like if they're in high school, is it easy for them to obtain some sort of like internship or not, even if it's not an internship, maybe like a shadow day?
Yeah, I think that's what's hard about it. It's because of that confidentiality piece. It's like, that internship, it probably just couldn't happen because of that. Like most people probably wouldn't be okay with a high school student like sitting there listening to their trauma. And so it's hard. I think like with social work, a lot of it is like the experience is doing it, because there's no real exposure to it otherwise.
Yeah, I can definitely understand why that would be in place, because it is such a vulnerable like topic that some clients may bring up. But I want to use this moment to highlight and encourage high school students, if they are interested in the profession, to seek out other resources such as this webinar. It's a perfect opportunity to like speak to people that are in professions that you're interested in and really learn how it is for them and what their day is like and their experiences. So I think that is valuable as well. Like it's not going to be the same as sitting there and going through their day with them, but it does give you some insight still.
Yeah, definitely. I agree. And I'm so happy that you guys have provided this platform for that, because I wish it was available when I was like just getting into it for sure, because I had tons of questions. And so this is a great resource for those, up and coming like young high schoolers who are interested in it, definitely.
Yeah, thank you for supporting, Lina. We're so happy to have you. Let me move on to our next question. So our next question is, we want to discuss your first encounter with a client. How do you approach this, and what are some important factors to consider?
Yeah, I think I touched on it just a little bit, but so like for an initial client, is that the question? Like a
Yeah,
first.
so you're meeting this client for like the first time. Let's just say you have like brief like past medical history, but what's your thought process and how do you approach it?
Yeah. So I definitely will review like their history. That's, medical history, their social history, any mental health history that may be included in their referral, or if they're self-referred, then we kind of have to gather that during initial assessment. So even then we do send out like a really brief like intake questionnaire for clients to fill out. I'll review that before I see them just to kind of get an idea of some things and some questions that I might have. A lot of times people are not very detailed in it. It's more of just like yes or no. And so you still have to really dive into it and use your motivational interviewing skills for sure during assessments. But I'll review any, relevant documents that we have access to, kind of review and go over with them like their client rights and also their responsibilities. That's a big thing. Do the assessment, which is like a mental status exam, assessing like their insight into their own mental health, like how much do they know and how much has happened and where are they at in their journey. We also do safety plans as needed if they have like a history of like self-harm or suicide, anything like that. Yeah, I kind of just go over like my role as their therapist too, because a lot of times clients will come in and they don't really know what therapy is about. And so I'll go into detail about that and I'll say like, this is their journey and I'm just a passenger, on the ride with them, kind of helping to guide them and offer some tips and tricks and they can use them if they feel that it's helpful, and I'm here to listen. I just kind of really simplify everything for my clients to kind of understand, especially for my little people. Initial encounters, that's pretty much it, and I explain like their treatment, um and we kind of establish like their schedule for future sessions, if that's weekly or bi-weekly, depending on their availability. That's pretty much first encounters.
I do have a follow-up question. Like, at the end of your visits, do you establish like a goal for your patient, whether it's like something you want them to accomplish or work towards before you see them for the next visit?
Yeah, great question. We actually go over their goals for therapy. It could be like, I just want to improve my self-esteem, and I just, use my clinical terms to develop that into a goal. If they're like a Medicaid client, then we do have to form like a CCA for them. Those clients have to do a CCA, and it has to be like very specific about their goals. It has to have like a timeline and everything.
Oh, are you talking about SMART goals?
Yes. Oh my
Okay,
gosh. Thank you.
you're welcome.
Yeah. Yeah, so it has to be a SMART goal. That's part of the initial assessment. Like I go over what their goals for therapy are. I try to really get them to have at least like 2 to 3. A lot of times some will just come in with like one, like I just want to feel better. And so I kind of, use those motivational interview skills, like what does better mean for you? What does that look like? And then, dive in deeper to like other goals.
Our next question is moving towards our Hmong identity questions. Our first one here is, how do you integrate your Hmong background into your practice with clients?
Um, so being of a minority, I give space to like my clients of color to really express and discuss like oppression or discrimination. I think a lot of times that's not really brought up in therapy, especially if your therapist doesn't look like you, right? And so I try to give that space to my clients. who I feel like during our treatment progress that there are some underlying issues related to like their race and ethnicity that I feel that we should address. And so I'll bring that up as, we go. But I think just being like culturally competent about things and like having that, like being mindful that there are multiple parts to a person, and that their experiences are not just tied to like their relationships, it's also tied to like their background. Just being mindful of that and giving them the space to share those experiences.
Our next question is, what are some unique needs or concerns of the Hmong community you have witnessed and feel should be addressed?
One thing that really weighs heavily on me is substance use in our Hmong community. There's just, I could go on about it, but that's something I feel needs to be addressed. But it's also like a double-edged sword because it's such like an integral part of being Hmong, right? Especially for a moment. There's so many connotations tied to drinking, and so it's just hard. But I think that's something that I wish our community was more open to, like addressing. Also, just it's that education piece. Like, people don't know what they don't know. Like, they don't know it's a problem if they just don't know it's a problem. Nonprofits like you guys, it's just great because then you are that platform to kind of educate and give access to folks who are curious to kind of raise awareness in a sense to really bring about these discussions that are hard but that need to happen.
Thank you so much for bringing like these topics on to discuss, and definitely even like us having speakers like you helps us so much. So thank you for being here with us.
Yeah, my pleasure.
Our next question is asking, what future initiatives or changes do you foresee as more Hmong individuals in North Carolina are pursuing the social work profession?
Definitely that access piece, seeing a provider that looks like you, and so like really feeling motivated to seek treatment. I mean, I love that there are more Hmong individuals who are interested in like mental health professions, or just like the growth in wanting to know more about mental health is a great thing because it's like as part of like our Asian culture. Like, we don't see mental health as like an issue, right? Or like it's a part of a person at all, really. And so just having those conversations is a great thing. And I see a lot of changes happening for sure with the generations to come. I think kids are more self-aware, and with that comes like that resistance to like conform to.
It's definitely like breaking the stigma, and
Yeah.
creating things like this webinar and other programs and projects that are really creating like conversations that
Yeah.
destigmatize mental health in our
Yes.
community.
Those are the terms for sure.
You mentioned culturally competent treatments in your bio that you shared. How do you envision this panning out in clinical practice?
There's a lot of like treatment disparities, like between people of color, versus like their white counterparts, right? Asian Americans are like, they're not likely to seek mental health support. I don't know the actual stats to it, but it's pretty low. And so I just, and I think a lot of that has to do with like what I mentioned, like not seeing a provider that looks like them. And so they don't feel like they can relate to the clinician that is working with them. And the culturally competent piece, I mean, part of us being a social worker, like that's part of like our core values, and code of ethics is like practicing with like cultural competency. But I think where I was going with that is focusing like treatment that is appropriate for Asian Americans, because a lot of like the widely used treatments that we do in like therapy, for example, like CBT, it focuses a lot on the individual. It's rooted in like challenging the individual to kind of form like a clear idea of like their own thoughts and their own kind of attitudes and expectations. And that can be like challenging for, Asian Americans, because we come from a culture that emphasizes like interdependence or like spirituality to kind of guide decisions. Sometimes that can be challenging for your Asian American clients, and treatment is not as successful. And so for me, like I just really want to grow in my skills to where I can work with Asian clients in a way that best serves them. It shifts the focus more of like just like the Western rooted ideas of treatment to more like culturally competent.
I am so happy that, we have you locally that can help, future local, like Hmong individuals who want to seek out like mental health care, because being culturally competent is so important because there's not a lot of us like seeking mental health treatments.
Moving on to our next question, Lina, if you could give advice to your younger self and young Hmong individuals, what would it be?
Focus on like really my education. That would be my advice to myself. But Hmong individuals, finding out what you enjoy and figuring out how you can make a career out of it. Like this may not be mental health related, but I think that like we care so much too about like our parents and our family, right? And they influence so many of our decisions. And I think that like we neglect ourselves. And so my advice for like young Hmong individuals is just, if you can find like a happy medium, do that for sure. But like, like pursue what makes you happy and what makes you feel fulfilled, and go for it. For me, like my parents did not believe in this profession for me, and they were not supportive of it. Like they just didn't find value in being like a social worker. And I still chose to pursue it, and then now like they see the work that I can do and they respect it. And so I think just staying true to who you are and what you want, and in the end, like everything will be okay.
Thank you for sharing such valuable words of wisdom. A lot of times it's even if it's not a career that our parents would choose for us, part of that is that they just don't know or don't understand what exactly that career entails, you know? And so part of the journey is going through it yourself and kind of allowing your parents to learn alongside you. And I'm so happy for you that you're at this point where your parents can understand and do appreciate the work that you do as well.
Thank you.
We are moving into our closing questions now. First one here is, what is one thing that you cannot go a day without as a social worker?
Definitely coffee. Caffeine is very big for me because, as an outpatient therapist, I sit in session for an hour listening to my clients. And so it definitely can be a lot sometimes, especially when you have like a booked day of like back-to-back sessions. So coffee is definitely my best friend. Also, one thing I can't go with a day without, planning ahead. Like I think I'm very type A. Like I plan things ahead just to help with my anxiety as well. I always like to know what to expect and like which clients I'm going to see, and then just really organizing my day is really helpful for me as a social worker, as a therapist for sure.
Do you have a go-to coffee order?
At Starbucks, I love their brown sugar shaken espresso. That's like my favorite right now. It was like matcha for a long time, but
You
yeah,
made a switch, huh?
yeah. I'm like that. Like I'll get into something and like overindulge myself in it, and then like change my mind to something else.
That's okay. You know what? As long as at the end of the day you get your caffeine,
Yes,
right?
for sure.
Our next question is asking, outside of work, how do you unwind and practice self-care?
Um, Well, I make it a priority to try to practice gratitude, just for my own, like my own mental health and my own healing, like just to change my mindset to be very like more optimistic and positive. So I practice a lot of like gratitude to unwind, because the day, depending on the day, like I can feel really defeated at the end of the day, right? For me, just practicing that, it helps me with my own like kind of mental health. And then my family and I, we recently bought a home. So a lot of like my outside of work time is dedicated to, to cleaning and organizing and, figuring out my style for my home and just raising my kids.
Congratulations on your home. That's
Thank you.
exciting. But yes, I love how you mentioned practicing gratitude. That is also something that like me and my husband do. Like at the end of the night, like before we sleep, we're like, what's one thing you're grateful for today?
Yeah,
Because
I
it
love
can
that.
be, yeah, it can be just like so much like the motions of just everyday life.
Definitely.
This is our last question for the question and answer section. If you could have any superhero power, what would it be and why? How would you use that superhero power?
Can it be anything or does it have to be like work related?
It can be anything.
Oh, okay. I wish I could fly at the end of like a hard session, just fly to the beach and then be like back for the next session.
That would be such a fun superpower. Imagine all the places that you could go.
What is y'all's superpower?
See, at first I was like, maybe, um, to read minds, but then I was like, I don't really want to know what people are really thinking about me. And then, I really liked one of our speakers, she mentioned like teleportation
Oh.
just to like get from like point A to B in like a snap of a finger. And I was like, you know what? I like that because I could use a vacation right now.
I hear you.
I haven't thought about it, but I'll get back to you once I find a superhero power that I would want to have forever. We'll move into our closing. I just want to thank you, Lina, for being here so much. And thank you to our listeners for tuning in. Here on the slide, we just have some information to recap. We have Lina's email here, and you can reach out to her if you have additional questions. We also have the North Carolina Hmong Women's Association website link and our Facebook page as well. And here on the right side of our slide, we have the flyer for the Hmong Women Lead Conference. Once again, it will be hosted on June 8th through the 9th at the University of Denver in Colorado. And I just want to put another reminder that it is a free event for all to attend. If you're interested in participating in the first of its kind summit where Hmong women can gather and have open and honest, challenging conversations about mental health. And with that, I would just let Lina and Brittany say a few words.
I just want to thank you both for inviting me to, be a featured speaker for this awesome webinar series. I wish y'all like the best of luck going to the event, and I can't wait to hear about what you guys like received and learned from the event and what you have to share for sure. And just thank you for this platform too. This is a great organization and I look forward to like all that you guys are going to do and what you're going to provide for the Hmong community.
Thank you so much, Lena. And thank you, again, 100 thank yous for being here with us and just sharing more about your career, what you do day to day, and a little bit, about your life. And thank you, Lisa, for also just leading this Paving Pathways webinar series. Thank you again to like our guest speaker and our listeners, and we will see you guys next time.